Leopold'S maneuver are a systemic method of observation and palpation to determine fetal position, presentation, lie, and attitude. For the purpose is to determine the fetal presentation and position and the expected location of the point of maximal intensity of fetal heart rate in the woman's abdomen. It is preferably performed after 24 weeks gestation when fetal outline can be palpated. A full bladder may obscure the findings. For special consideration, first, we have obese clients have thick belly fat, which can also obscure the findings. Second, special considerations, patients who are polyhydramnios may give the examiner a little difficulty. However, reassessment and rechecking of another nurse and intravaginal examination, or IE, can help to confirm the findings. First procedure, prepare the patient. Wash hands. Washing hands deters the spread of microorganisms. Good day, ma'am. Are you Mrs. Ken? Hello, Mrs. Ken. I am Cala-or, your student nurse for today. I will be performing Leopold'S maneuver to determine the fetal position of the baby. But before we go to the procedures, we'd like to go to the comfort room to empty your bladder. Emptying your bladder will promote comfort and allows for more productive palpation. Next step, position the woman supine with knees lightly flexed. Place a small pillow or rolled towel under one side. Flexing the knees relaxes the abdominal muscles. Using a pillow or towel tilts off the uterus of the vena cava, thus preventing supine hypotension syndrome. Next step, drape the patient to maintain privacy. Next, warm hands first by rubbing them together before placing them over the woman's abdomen. Next step, observe the woman's abdomen for longer diameter and where fetal movement is apparent. Next procedure, performing the first maneuver. Stand at the foot of the client, facing the client, using both hands, feel for the fetal part lying in the fundus. Palpate the superior surface of the fundus. Determine the consistency, shape, and mobility. Second maneuver, the umbilical grip. Face the client and place the palms of your hands on both sides of the abdomen. Next, palpate the sides of the uterus. With left palm stationary on the left side of the abdomen, to steady the uterus, the right palpates the right side of the uterus on a circular motion from top to lower segment of the uterus, applying gentle but deep pressure to palpate the fetal outline and small fetal parts. Third maneuver, the Leopold'S grip. Gently grasp the lower portion of the abdomen just above the symphysis pubis, between the thumb and index finger, and try to press the thumb and your index finger together. Fourth maneuver, the pelvic grip. The nurse is facing the feet of the client. Place one hand each on either side of the lower hole of the uterus. Palpate the fetal head by pressing down about 2 inches above the inguinal ligament and use both hands. Next, place your client in a comfortable position. Document the procedure and assessment findings and the client's response to the procedure. Wash hands. Washing hands deters the spread of microorganisms.